Good afternoon, everybody. We're glad you joined us today to learn more about Montclair's 30 credit online rn-to-bsn degree program. I'm Joan Vallis, and I'm the director of the post-licensure nursing at Montclair State School of Nursing. So I'm glad you're here today. We want to talk about why choose nursing. You've already gone part of the way, and now you're ready to go a little bit more in your professional development by looking at a BSN degree. And you know that there's quite a body of RNs that are projected to grow, for an employment in those 2 past years, and it probably is going to go faster than that. So there's jobs out there that we can fill. And according to the U.S. Bureau of Labor Statistics, there are 198 and 193,000 openings projected each year. So that's been going on for quite a while. And I suppose it will continue for quite a while. So there's always, a good future and a good good lookout for positions. And it's probably the reason is that they're looking at the BSN is that it has been required by most hospitals that you might want to practice in. During COVID, that fell back a little bit because they needed all hands on deck. But I think people still were going to be held to their agreements about completing a BSN with a certain number of years. And the number of years that they allow for the BSN varies from institution to institution. And that's not laid in stone either, just so you wouldn't have to worry about it. There are reasons people delay, and usually, if you've been working there with them for a while, they will give you an extension. So it's not something that you keep in the back of your mind, but don't let it, upset you that you aren't going to make it, because life happens. We all know that. So, next slide. Okay, let me tell you a little bit about our school in general. We have both undergraduate and graduate students, and it's really a full program, and we have certainly a diverse community here at Montclair. I don't know if you've ever been by. This is online, so you may or may not ever see it, but hopefully you'll come by because it's really a beautiful campus. So we have your traditional 4-year BSN. We have the one that we're talking about today, the rn-to-bsn. We have an online MSN, which is also post-licensure. There's a pre-licensure MSN for those who have bachelor's or higher in a non-nursing degree and want to become a nurse. So that's what we call pre-licensure. And then we have something called the RN to MSN bridge. And that's for people who have a bachelor's degree completed, and it's a non-nursing bachelor's, but they completed an associate's or a diploma and have an RN. So they can cross over into the MSN program after completing about 13 credits of undergrad courses and move into our MSNs. Go ahead. So this program is 30 credits. It's part-time, and it's really laid out for the working professionals. And really, it's trying to get yourself moving along towards a bachelor's degree, but working at the same time. So we have the courses are asynchronous online, and we offer them spring, summer, and fall. Our semesters currently are full semesters of 14 weeks. And it's really a flexible program that allows you to earn your degree at your own pace. You just may have been, nursing for quite some time and been out of school, or you may just be coming to school, but you're working, and again, life happens, and certainly it's flexible enough so you can get through it at your own pace. And you build on your experience really with a curriculum that has some real world applications. Next. So we'll look at the curriculum in an overview. we use evidence-based knowledge from nursing and the sciences as the basis for practice, and that you know already. We manage emerging information technology to enhance nursing practice and improve outcomes. And we like to consider that you'll be able to, demonstrate effective communications. And it's pretty important that we, establish these professional relationships and interprofessional relationships, both in the hospital and in community settings. Okay, so just take a look at this for a minute, and you'll be able to see what we offer. I'll go over the courses one by one. Just to let you know, this is not a sequence of the way you take the courses. And we do have a curriculum plan, that we would give you if you came in to see how you can get through it. But this is just a listing, all right? So informatics is what information technology and nursing practice is about. It's, it's learning how this kind of technology has been brought into the workplace. And for that matter, I'm sure if you've experienced it already, I mean, there is an electronic chart now. There's, no more charts, paper charts or anything like that. And it's certainly, even the pharmacy, right? Those kinds of things are all electronic. The orders are written electronically. They go right to the pharmacy electronically. And probably somebody brings them up manually to you, or they have some other method. But that's because it's that, and it's also about using electronic data in your practice and in your assessment of patients. Evidence-based practice is nursing research for the most part. And what you do at this level is not conduct research, but know that the research is there. And when you find it, you use it. That's what we call evidence-based practice. It's the way that you can be sure that you're actually practicing at the top of the nursing knowledge and medical knowledge, that this has all been proven research data, and it's evidence that you're going to apply to your practice. Genetics and genomics is becoming increasingly important in healthcare because so many things are driven by genetics and genomics. So the application of that to your practice is certainly valuable to the things that you may have already learned, like anatomy and physiology. And leadership. Certainly there are people who are in leadership positions without bachelor's degrees, but certainly people with bachelor's degrees have the ability to move into nursing leadership. So we explore the theory of leadership and its application to nursing. I spoke about transprofessional communication as interprofessional. Transprofessional, interprofessional, or words that we can use either one of those in saying almost the same thing, but certainly the communication and collaboration between us, and I'll use the word them as other, but certainly that's very important because we all have to stay on the same page if we're going to do the best we can and make sure our patients have the best outcomes. Population and global health. That's another word for perspective on community health. So it has a didactic and it has a practicum. We'll show you what that's about. But certainly, maybe some of you've had that experience and maybe some of you haven't, but certainly understanding what's outside the walls of acute care in the communities, in certain populations, and even larger than, some zip code or something, a larger geographic or global area. And treating patients and transitioning them from one setting to the next is very important for nursing to make sure that everything that happens, let's say on the inpatient side, gets communicated and transferred to the outside. Or if there's somebody who's living in the community and you work there and you recognize something that needs to be done, and you understand what this patient needs, and get them transferred to where they need to be sent, and some kind of intervention is provided. So I'm going to go to the last one first. This is nursing scholarship. The reason it has the number, it's the last on the page, because we've listed these numerically. It has nothing to do with being the last class. But what it is, it's an opportunity to learn to look at evidence and research and try to write something scholarly. And it's very important that people with the BSN level, which is the first real professional degree, and you can move yourself on to a master's and a doctorate easily. And you may think about that already. But certainly being able to write clearly and using the evidence that you have to communicate. And that's what nursing scholarship is about. And so we hope that you'd be able to take that with or after nursing research, which is evidence-based practice up there. Now, the really last class is the integration practicum. And that course in itself is designed to pull into the course everything that's above it and that you learn. And how are you going to apply all of that to something that you want to do professionally? So you may identify a mentor or a site where that you'd like to explore more, do a certain amount of clinical time there. So it helps you in a direction of, that maybe this is where you'd like to go in your career. And it's an opportunity to express a lot of these things, particularly leadership as well. So those are the courses, and we'll move on to the next slide. And here we'll be talking about the clinical requirements and the population global health. The one that I told you is community health nursing. That has a clinical of 30 hours. So it isn't about going to one place and staying there, X number of hours per week. There are multiple opportunities to go different places and explore different things for those 30 hours. All right. And the practicum for 40, which we just spoke about, has 60 hours. And that certainly is reasonable. You may be spending a little bit more time exploring the things that you think you may want to be doing in your future. So some of our clinical locations, just to name a few, are anybody who's in the RWJBH system, because these are all basically systems. The Kessler Rehabilitation is one center, and then the Hackensack University Medical Center and its affiliates as well. So, and then there's another place is Atlantic Health, Morristown. There's a lot of places that belong to that system. Okay, next. So I know some of you are interested in transfer credit evaluation. It is the undergraduate admissions that does the credit evaluation and transfer. And knowing that a lot of you probably come from our community colleges and diploma schools in the area, you come with everything that you need, all right? And to tell you that in New Jersey, you have to have 120 credits for a bachelor's degree. So this is how it works. When they do the transfer credit evaluation, they're looking at what you did in your previous degree, whether it be the diploma or it be the associate's degree. You all have the content that is needed. So we're taking everything. And mostly it's 60 credits. That's what it adds up to. And 60 credits come across that you'll need. And then we give you 30 credits once you pass the NCLEX. You can enroll, you can apply, and you can enroll in it, and you have 6 months to pass the NCLEX exam. I'm sure you're going to be able to do that, but we give you those 30 credits. So you do the math, right? 60 and 30 is 90. So you have 90 credits just like that. Going to get your associate's or diploma and passing the NCLEX. That's 90 credits. All right. We're looking for statistics, and hopefully you've done it within the past 5 years. A lot of people come from the community college with it, so it gets applied. And others are taking it here now because there is an online statistics course. But if you can't get into that one, certainly wherever you take it and it's online, you can transfer it in. So what that adds up to, if you've already got the 3 credits for stats, it makes it 27 degrees. If you need to take it yet, it'll be 30. So you've got the 60 transferred in. You've got the 30 we're giving you just for passing the NCLEX. And that's not something that we just did. That was done with research. We had been bringing people in and they were doing competency exams, the same level you are now, and they passed all of these exams, these challenge exams. So with that, we said, well, these people are prepared and they're at a level that they have this competency, and we'll award them 30 credits. So you have the 60, you have the 30, and now you have another 30. That's 120 credits. So you're only looking at 27 to 30 credits to get your bachelor's degree. Next slide. So here are some of the requirements. All right, for this, if you're looking at it right now, it's this fall. It's a completely online application, and that is the site that you would go to. If you go to our website and you'll find it. It'll be there, probably right on the front page or off to there's a little drop-down box, and you'll be able to see it there as well. We need all your official transcripts. You have to be a graduate from an accredited associate or diploma degree program and have or be going for the New Jersey license. And once you have that licensure, that's all we'll need. So anyway, down the bottom it says nursing students currently enrolled in an associate or diploma program who will complete their program prior to the first day of class will pass the NCLEX within 6 months of and then matriculate. So next slide. We also have some tuition discounts. So if you're working or going to work at Mountainside, which is part of the Hackensack system, if you work anywhere in the Atlantic Health System, and that includes Morristown, I think it's Chilton, there's a whole slew of places that are in the northwest section of Jersey, and also St. Joseph's University Medical Center. And if you're employed at these institutions, you'll get 20% off the tuition rate of $425, 16 credits making their tuition cost only $340 per 13 credits. So, not 13 credits, $340.13 per credit. So, and then there are no, the waivers for all the mandatory student fees, right? And then, wherever you work, there's probably tuition reimbursement from your institution. And sometimes your employers also offer scholarships. So you're looking at a pretty good reduced cost for tuition at Montclair, and that's always important. Next. So if you have any questions and you want to raise your hand and then we'll unmute you. If you don't have any questions right now, save this number and this email and just, call or email. We'd be happy to help you. Okay. There we go. Marie Carmel Bernard.
Hi.
Hi.
Yeah, I couldn't find the raising hand.
That's hard to find.
Button. 2 questions. One is, so if we enroll into the rn-to-bsn, and then like maybe a couple courses in, we want to do the rn-to-msn, and we have a bachelor's in business, like I do. Can we switch over, or should we just complete the BSN and we could quickly just roll right into the MSN? Will the time length of studies be different, or how would you advise that?
let's say that that's a decision that you should make beforehand. But I will tell you that the courses that you would be looking at for the RN to MSN are, go back to that slide where it had all the curriculum laid out. I mean, yeah, here you go.
Mhm.
340, 350, 410, and 420. Those are the courses, and 432. Those are the 5 courses that you would take to bridge to the MSN. They would not confer a BSN degree. You go straight from associates to MSN with your non-nursing bachelor's degree. And that all has to be evaluated. But certainly if you start and opening course, I think in the fall, I really think we do have 350 and probably 420. So,
Okay.
and our courses are already posted up there, but I'm not sure that you can get into to look at them. Sometimes if you look at the catalogs, you'll see when they're offered. But
Gotcha. And
that's
then,
something to think about, and we could discuss that individually. Give me a call, and we'll talk about it on the phone and see how you'd like to pursue that.
thank you. And then I had one more question is, so I'm licensed for New York, and I don't know the process of getting to do the New Jersey one, but I could still start with the New York, and then within 6 months I have to get the New Jersey, or
No, that's for new nurses who haven't been nursing
oh,
yet.
okay,
No, you'd have to have it, upon entering the program. I mean, it isn't a big thing to get it. It's
okay,
they not used to call it reciprocity. Now they call it endorsement. So
endorsement.
you just go to the Board of Nursing and click the thing for nursing licenses, and then there's a track there to apply for endorsement. That's
Okay,
all it really is. And we also, the clinicals have to be done in New Jersey. We can't
right.
cross the border into New York because it's New York that doesn't allow that.
You got it.
So,
Okay,
okay.
nursing
All right.
endorsement. Thank you.
All right. Anybody else got a question?
Dr. Vallis, I did have a question sent directly to me. Um, Someone wanted to know for the transfer credit, do you accept transfer credits from CCM?
Yes. Yeah, all the community colleges are wherever you come from. CCM, PCCC, uh, Hudson County, Essex County, Bergen Community. That's where I went. I was an RN to BSN. I went to Bergen Community first, and then I went elsewhere for my other degrees and had tuition reimbursement to pay for it then. So, yeah, any of the community colleges. Okay. All right. If there's no other questions, this will be on our website, or you'll receive a copy of it so that you can, go over it again. We have all the information to contact us. All right. And we'd be happy to see you apply. All right. Thank you very much. I'm happy you were here today.